The Asian Pacific American Medical Student Association is a national organization founded in 1995.
We're the only organization that focuses on Asian Pacific Islander health issues. We have a focus on both working with communities that our 87 active chapters work with, spanning across 8 regions all across the country.
We are committed to addressing health disparities and raising awareness of health issues that disproportionately affect the AAPI population in our country. Let's learn more.
For a long time, there have been medical student organizations for other ethnicities such as African Americans and Latino Americans, but despite the large number of Asian American medical students, there wasn't an organization for APA medical students. And it's not that our groups haven't tried before. I believe there were attempts in the 70s and 80s, but finally in the 90s, we had a tool that let us actually pull things together at a national level, and that was email. Before the 90s, only computer nerds had email, but then finally in the early 90s, regular med students had email, and then because of that, they were able to actually get organized at the national level and to communicate with each other. And one of the key foci for this was Dr. B. Lee at Ohio State University at that time, and he was someone that started a local APA med student chapter there.
My name is B. Lee, and I'm a pediatric gastroenterologist at the Medical College of Wisconsin. I happen to be one of the founders of APAMSA in 1995, an organization that serves Asian American medical students all across the U.S.
And he was able to sort of rally people to try to form something at the national level. And so again, through email over in 1993 and 1994, we were able to sort of get organized, and literally in the summer of 1994, we got around his dining room table and talked about actually having a national conference. And we set that first national conference in January 1995 in New York City.
Hepatitis B is a silent killer amongst the Asian Pacific Islander community population. 1 in 10 to 12 are infected with the Hep B virus. As such, APAMSA has made a tremendous amount of efforts in educating future medical students about the hepatitis B epidemic and also contributing to the community through our local grants. Many of our local chapters have so many wonderful events that raise awareness for hepatitis B through free vaccinations, free screenings, and also free education programs for not only the patients but also for many providers within the community.
So the biggest challenge I think in our community is now stepping forward and being willing to share our own struggles and our own mental health related issues that we're going through. It's been very clear that everybody understands how important it is for us to break through the stigma and the silence that has been holding us back in the mental health and wellness arena in the AAPI community. But I think the biggest step is now having everybody sort of step forward and bring their own story. So in another sense, breaking down their own image that they've created for themselves and being willing to be vulnerable with others. And I think it is only through that we're able to get true investment and buy-in into getting into better mental health and wellness for our communities.
APAMSA has a health affairs branch which houses cancer initiative, community outreach, hepatitis B and C conference and community grants, as well as bone marrow awareness and health education and advocacy.
And we also have regional conferences, and so last year we had 8 regional conferences spanning all across the country. It's a great opportunity for people to meet with other members in their region, along with getting a chance to talk about specific Asian Pacific Islander health issues that might be specific to their region.
I made some great friends all the way from New York to Boston while planning the regional conference 2016, and we got to bring around tons of professors and physicians from the area to meet students like you.
Surprisingly, this may actually help you in your professional career. When I look back on my own career, for example, I feel that the most important skills I use today in my career, I learned outside the classroom, such as forming student groups, leading a task force, and starting a student newspaper. All of those led me to develop leadership skills, and those are the skills I now use. So ironically, being proactive, spending your extracurricular time doing things for our communities may inadvertently help you become a better physician and more successful professional.
So I remember my first year running for database director at my first conference in Vegas, and I ran completely on a whim. I didn't know I would get so involved with this organization, and it's been a really amazing experience for me because I've been able to really develop my leadership skills, being part of a national organization.
Okay. Out of the past 4 years that I've been involved in APAMSA, I think one of the most important reasons I think you should be involved is when you're in health professional school, you have such little time, such little free time. You have all these things you have to study, you have your clinicals, you have this appointment to run, you have this test and everything. So the free time that you have has to be spent meaningfully. APAMSA has put so many awesome people into my life, so many cool experiences that help society out, and have given me insight into who I am as a person. I really hope that you get involved with APAMSA.